This session aims to provide an introduction to voice therapy, an overview of how the voice works, what could be causing and maintaining your voice problems, strategies to improve your voice, as well as the care pathway that we provide. Everyone in this session has been seen by the ear, nose and throat team, who have ruled out any nasty causes for your voice problems. You have been referred to us, the Speech and Language Therapy Voice Service, because your voice box is not working efficiently. This can be referred to as a functional voice problem or a muscle tension voice problem. Generally, voice therapy is implemented in two parts. One part is vocal hygiene advice, which ensures we are taking care of our voice box to optimise our voice, such as drinking enough water. The other part consists of vocal exercises, which aim to realign the muscles in the voice box, as well as taking the strain out of them to allow for more efficient voicing. We are aiming to reset the voice box. An important aspect of voice therapy is knowing how the voice works. There are three key mechanisms: the lungs, the voice box, and the mouth and nose. Air pressure in the lungs drives through our closed vocal folds in the voice box, which then vibrate. This creates sound. This sound is then shaped and amplified by the spaces in the mouth and nose, which results in our unique voice. A problem in any of these three key areas can lead to a voice problem. Good voice projection and good voice quality require deep breath support. Insufficient breath support results in the muscles in the voice box becoming overused and strained. The surface of the vocal folds need to be moist, but infection, smoke and tension can cause dryness and changes in the voice, as the sensitive membrane can become irritated. The spaces in the nose and mouth give your voice power and individuality. If these spaces become blocked, for example when we have a cold, the voice lacks power, and this puts extra pressure on the muscles in the voice box. Here is an image of how vocal folds come together to produce voice. There are many different factors which can contribute towards voice problems, such as lifestyle, medical, and environmental factors. For example, your job may require high vocal demand, such as working in a call centre or as a teacher. Stress could also be causing tension to build up in the muscles in your voice box. Respiratory conditions like COPD and asthma can also make you cough more frequently. A hearing impairment may cause you to talk loudly and overuse your voice. Or you may be exposed to air conditioning, which can dry the throat. It is likely that you experience a combination of some of these factors. Here are some common symptoms described by people who have voice problems. Perhaps you can relate to some of these. You may have experienced voice issues in the past and recovered in a timely manner, for example, during a cold. You might be wondering why your voice problem has persisted this time. Here are some of the factors which can maintain voice problems. We will now go into these in more detail. There are many different triggers for clearing your throat. It could be caused by irritants, such as smoking, alcohol, and acid reflux. Sometimes people get into the habit of clearing their throat too often, which can cause inflammation to the vocal folds and an increase of mucus production, which can begin a vicious cycle. In order for your vocal folds to vibrate efficiently and produce voice, they need to be adequately hydrated. It is recommended that adults drink 2.5 to 3.5 litres of water per day. A good way of measuring your own hydration is to check the colour of your urine. Pale urine indicates that you are sufficiently hydrated, whereas a darker urine suggests that you are dehydrated. It is also recommended that you drink less than 5 caffeinated drinks per day, as they can dehydrate the body. Switching to decaf tea and/or coffee is a really good way to increase your hydration. Smoking can irritate the larynx, vocal folds, and dry the vocal mucosa. This can cause inflammation of the vocal folds, as well as coughing, mucus production, and a feeling of irritation. As well as this, it can affect the functioning of your lungs, which means reduced breath support for voice. Unfortunately, it can also increase the risk for vocal fold cancer and other vocal fold issues like Reinke's edema, which is pictured here. Although this may seem counterintuitive, many cough sweets contain ingredients which can irritate the lining of your throat and also dry out your throat. Instead, try sucking on some frozen grapes, sugarless boiled sweets, or chewing gum. This will encourage the production of saliva, keeping your throat feeling moist. Everyone has acid and enzymes in their stomach which digest food. At the top of the stomach is a valve which closes up to prevent food and stomach juices escaping back up into the food pipe. If the valve does not work properly, the juices can leak back into the food pipe and can cause heartburn. Sometimes the acid travels into the back of the throat and spills over into the voice box, causing irritation. This is called silent or laryngopharyngeal reflux. Often there can be no associated heartburn. This can be managed by stopping smoking, reducing caffeine intake, avoiding fruit juices and fizzy drinks, limiting intake of fatty foods, reducing alcohol intake, avoiding eating within 3 hours before bed, and losing weight. You can also trial Gaviscon Advance. Catarrh can be persistent and often causes some changes in the voice. It is most commonly at its worst first thing in the morning, upon waking, although it may vary during the day due to the severity of the problem and other environmental factors. There are some simple steps that can be taken to try to reduce the symptoms, such as inhaling steam, staying hydrated, reducing throat clearing, and avoiding certain foods such as dairy, fresh orange juice, and chocolate. Your GP may have also prescribed a nasal spray and/or tablets to take, which could relieve the catarrh if taken regularly. It is important to be aware of how you use your voice. If you are talking in noisy environments regularly, you may be pushing your voice too hard. You may continue talking even when your breath has run out. Using a higher and/or louder pitch can also cause tightness in the voice muscles. This can lead to habitual constriction, causing voice fatigue. This is common with teachers, for example. Think about times when you use your voice and it feels uncomfortable. Could you do something differently? Our throat muscles are like any other muscles in the body. If you feel stressed, this can cause tightness of the voice muscles. Mindfulness is a practical way to notice thoughts, physical sensations, sights, sounds, smells, anything we may not normally notice because our heads are too busy in the future or thinking about the past, about what we need to do or going over what we have done. Mindfulness is useful for noticing tension and subsequently releasing that tension. Breathing properly will help to support your voice. Good voice projection and good voice quality require deep breath support. Insufficient breath support results in muscles in the voice box becoming overused and strained.